The purpose of this video is to define what maintenance care should look like and shouldn't look like. Our goal is always to prevent, massive spikes in your pain that require a full-on treatment plan. We'd much rather have you pop in once every month or every 2 months or every 3 months to maintain the progress you've made. So this is how we go about doing it. So maintenance care is going to be defined as supporting the progress that we've made with you. This is going to be variable for each person, right? It depends on their metabolic health. It depends on how much degeneration there is. It depends on your activity levels. All of those things are going to dictate how quickly adhesion forms and how quickly we need to get it out there. Again, adhesion is like plaque on your teeth. It will build up over time if you're doing the wrong things, and it's less likely to build up if you're doing the right things. So we just need to figure out for you what that interval looks like. So what that kind of looks like in care is once we've reached our maximum therapeutic benefit, we're going to take a month off, and we want you to do everything that you want to do. After that month, you're going to come back in and we're going to say, hey, are you doing what you want to do? Do you feel little to no pain? And when we examine you, are your tests full? If so, that's great. That means there's not much for me to do. So we're going to move that follow-up appointment farther. So maybe we'll go 6 weeks or 8 weeks. And we're just going to keep repeating that process until that interval where you come in and you say, you know what, I'm starting to feel a little achy. Maybe I'm avoiding some things right now. Or maybe you're feeling great and we just identify a test that is shortened down that we can address and solve in that one visit. That's the ideal maintenance visit. And for some people, that's 1 month. For other people, that's 4 months. Really, it's going to come down to you, right? Are you maintaining your metabolic health? Are you maintaining a healthy loading schedule? That will make those maintenance visits farther apart, maybe 3 or 4 months, as opposed to saying every month as it is. So that's what maintenance care should look like. It shouldn't just be come in so we can talk and I can just do whatever. No, there needs to be something for me to work on and something for me to address. But at the same time, we don't want to say, hey, just come back when it hurts, because you're going to be in a lot of pain and we'll have to start the process all over again.